Hi, I'm Dr. Libby Heineman, one of the Scott City physicians, and I'm here today to talk to you about the COVID vaccine, and in particular to address rumors, fears people may have, and more importantly, the science behind the vaccine. When I'm talking with patients and ask them about the COVID vaccine, the most common response I get is, well, I'm just not sure, or I'm scared, or I'll just wait and see how this plays out. So I will often ask those patients, well, what exactly is your fear? And one of the first things I hear, or the most common things I hear, is that, well, it was just developed too fast. So I want to address that because that's a very, very common misconception. First, the technology behind all three of the vaccines, the two mRNA vaccines, which would be your Pfizer and Moderna 2-shot vaccine, and then the viral vector vaccine, which would be our Johnson & Johnson 1-shot vaccine. The technology behind these vaccines goes back decades. So many times we talk about vaccines being developed over 5 to 7 to 10 years, and a lot of that time is spent in research. Well, we were so blessed with the fact that this research has been done for decades. In fact, I'm going to age myself a little bit here, but in medical school for me, which would be about 2001, 2002, we were talking about mRNA vaccines, and in particular, an mRNA vaccine that was developed to the first SARS virus. And that was 20 years ago, so we were talking about it then. The difference is in those situations, these vaccines were developed against and have been studied against various viruses throughout the decades, but we didn't have a pandemic. Some of these were endemics, they were deadly, they were in a certain area in the world, but they didn't spread into a pandemic like we saw with COVID-19. So these vaccines had lots of research behind them. Then you talk about human volunteers. So many times when we are developing vaccines and they decide to test it within human subjects, you can imagine it might take 2 or 3 years to recruit enough volunteers to say, sure, test that in my arm. But when you have a pandemic, people are more than willing to step up and serve the public by saying, yes, let's get a vaccine. So that 5, 7, 10 years became a very short period of time. Plus, in a pandemic, a lot of government red tape and things like that can be put to the side, as well as money into development can be focused into these vaccines. The second thing that patients often will bring up is that this is just like the flu shot, and it is not like the flu shot. The flu shot is very, very different. With the flu shot, epidemiologists, which I kind of say are like the meteorologists of healthcare and science, trying to predict what viruses we're going to see in the next flu season. So they look at that and they look at lots of different data. They use science behind it, but they're predicting what 4 viruses we might see next year for influenza. And so with those 4 viruses, they then take the dead version of those viruses and combine them into the quadrivalent flu vaccine. So when you get your flu shot, you are getting injected with the dead virus. So your body sees that dead virus, the 4 variants, and builds up immunity to those 4 variants. That's why some years you may get the flu shot and then a few months later you still get influenza. You may not get as sick. Most of the people do not get as sick if they've had the flu shot, but certainly could get the influenza virus. So the COVID vaccines work very differently than the flu shot. With the COVID vaccine, you are not being injected with what virus we think we might see or what variant of the virus we might see next year. All of us are made up of cells that have our genetic code in them, our DNA, and our DNA tells our cells how to do something by sending out little messenger proteins. And these are like the mRNA. Okay, so mRNA, you're thinking, okay, I've heard that with the vaccines. Yes, so these vaccines work very differently. Early on in the pandemic, they were able to identify the genetic code of the SARS virus that causes COVID-19. And they were able to then identify some proteins that gave the message to that cell of how to make the spike protein. I'm sure all of you know the visual of coronavirus where we see, or the SARS virus, where we see the viral cell with all the little spikes on there. So with the COVID vaccines, all 3 of them, you are not being injected with what virus we think might hit next year. You are instead being injected with the instruction manual of how to make the spike protein. So your body gets this vaccine and it sees the instruction manual. I always tell my patients it's a little bit like a Lego manual. You're learning how to build the Lego ship, but instead this is the spike protein. So your body sees, oh, this is how I'm going to build that spike protein. And that is then what you build up immunity to. The beauty of this is that, one, say you've had coronavirus, you've had COVID this year, you're wondering, am I going to be immune? Do I even need the vaccine? Well, actually, yes, because your immunity is to whatever variant you saw. And by building up immunity to the spike protein, you should be immune to future variants that you might see. Also, we're starting to see some evidence of the fact that when you get this vaccine, that we are most likely preventing some asymptomatic positive cases, which should help us prevent the spread. Most importantly, all three of these vaccines have in their data excellent numbers in preventing what we care about most, and that is hospitalizations and deaths. Really, I care if you get coronavirus, I care if I get COVID, but what I care about more is whether or not we have hospitalizations and deaths. And that's what this vaccine does. It really reduces those. So that's where it's really, really important that we work toward vaccinating our community. Here in Scott County, we've been very lucky to have an amazing health department that has done a wonderful job throughout the pandemic. We have vaccinated approximately 1,000 people and are working to vaccinate more. We are adding the Johnson & Johnson one shot here at the clinic this next week. So if you are interested in getting vaccinated, you can call the clinic and ask for your physician's nurse and make an appointment, or if you're up here for an appointment next week, we'll have those available. Of course, the health department is also available to call, leave a message, put your name on the list to get your COVID vaccine. Overall, these vaccines are very safe. The technology has been around for a long, long time. And again, this is a very different technology. You are being injected with the instructions of how to make the spike protein. Your body then becomes immune to that spike protein. That's what gives us a better immunity. Of course, many of us do have a pretty strong and robust immune response to these vaccines. We do recommend that the day before and the day of your vaccine, you drink lots and lots of water and try to go to bed early after your vaccine. When people do that, they seem to fare a little bit better. Most reactions we've seen have been very mild, and we really don't see long-term side effects. We do know there are long-term side effects from the coronavirus, from infections people have had here in our community and of course worldwide with COVID-19. There's some new studies out there and we'll bring you more information as some of that comes through, but a lot of it is looking really exciting. Again, this is amazing science. This is good science behind this vaccine. So I'd encourage you to certainly consider getting vaccinated and helping us get out of this pandemic, because this is our way out, is vaccination. Thank you.